So I'm Professor Julia Davidson. I'm the director of the Institute for Connected Communities, which was formerly the Institute of Health and Human Development. And the ICC now incorporates the IHHD and the Online Harms and Cybercrime Unit. And the vision for ICC is to be a world-leading institute, research institute, that focuses on health and well-being, both in the real world and the digital world. We work from a multidisciplinary base. We have colleagues with expertise from many different subject areas, including sociology, psychology, criminology, across health as well, and human development. So, we're a really broad multidisciplinary team, and our focus is on fostering well-being in many different areas.
Hi, so my name's Dr. Darren Sharpe. So I'm a senior research fellow and also one of the deputy directors at the Institute. And my work is traditionally focused on children and young people and vulnerable adults. At the present time, I'm involved in three kind of key projects, really. One is the Communities Driving Change programme in Tower Hamlets. This predates the COVID, and it's all premised around supporting local residents around health creation. So rather than the council delivering services, they've taken a co-production approach where they've worked with communities in order to develop the local services they need to address their health concerns. And so that's been a major piece of work over the last few years, which has kind of straddled the previous IHHD and is coming to ICC now. And most surprisingly, before it was very much on the ground, it was neighbours meeting together in local community centres, unlocking local assets. But as a result of COVID, a lot of those activities have transitioned online, which has really warranted more investigation, really, going forwards into looking at how community work can take place online as well as in the physical world. And Tower Hamlets, for example, in their corporate strategy, they've always wanted to increase their digital inclusion. That has always been one of their great targets. And then again, through COVID and our lessons, through our research, it's actually identified some of the weaknesses and the gaps in terms of digital literacy in Tower Hamlets, but also the strengths where the asset lies, i.e. the kind of change makers who were brave enough to transition onto the digital platform and the types of platforms they feel comfortable using and what are useful for them. So that's one major project which is due to end in December. And of course, it gets all this kind of empirical basis from well communities, which actually that was the first major project in IHHD when it was formed over 10 years ago. And so it builds on a lot of empirical kind of evidence, as well as a lot of community engagement where we are today. The second project I'm involved in is a new project, and this is being commissioned and led by the Youth Endowment Fund, which is kind of a quasi-government body, what is looking at young people and violence, and more importantly, reducing violence. And so their broad kind of mission over the next 2 years is to really understand how young people understand violence or the risk of personal violence. And that's both online and offline. It involves young people from asylum seekers and migrant backgrounds. It involves young people who have part or have come through the care system, and young people from a diverse range of backgrounds. They will be working with 10 organisations throughout the country, and they will be conducting peer-led research into issues, what they define and what matters most to them. And they will then be feeding up their empirical data to the YEF, the Youth Endowment Fund, who will then be supporting them to lobby for change. And so through this piece of research, where our role jointly with UCLAN are the learning partners, partners. And so we're both evaluating all the 10 different approaches to peer research in terms of researching young people and violence, as well as taking that learning, feeding it back to the delivery partners. So there's always continual improvement in how they're supporting and delivering this research project. And so ultimately, by the end of the programme in December, well, actually it will be January 23, what the Youth Endowment Fund would have gathered would be quite a large data set, which is being kind of rigorously undertaken by young people, what can help them lobby for change to help young people feel and be more safe, both in the physical world and in the virtual world.
I'm Gopal Netuveli. I'm one of the deputy directors of the ICC and also the professor of global public health. I got one major project which is going on now. My background is actually in looking at health and well-being of older people, and that is a research I've been now doing for more than 20 years. And we keep on doing a small bit of projects, funded or not, looking at how older people's well-being are increased or decreased in the UK and outside UK, in Europe as well as in Asian countries. The project I'm working on is in India. It is the aim of which is actually to reduce blindness due to diabetes. And it is a 4-year project which will come to end at the end of this year. So we almost have done most of the work we promised we will do. It includes, the partners we have in UK includes the Moorfields NHS Trust, UCL, Imperial, London School of Economics and Oxford, and about 20 centers in India. And what we do in India is actually to try out whether we can have some semblance of a program which is very similar to what is happening in UK. That is, if you can catch people early on with eye problems and diabetes, maybe we can prevent blindness. That is a premise with which we are working. There are 2 different projects going on there in this aspect. One is an all India-wide house-to-house survey, where we go with handheld cameras attached to a smartphone, and which is which will take a picture of the eye, and it is transmitted, transmitted electronically to a reading center, where they actually diagnose whether the person has got diabetic retinopathy or not. And we are not trying to actually automate it because it is costly to have people doing this work. So we, in one of the smaller packages in our project is an artificial intelligence one, where we are trying to create an artificial intelligence algorithm which will diagnose diabetic retinopathy. But the part of the project where I am more involved is the one in a state in India called Kerala, where we work with the government, and we actually was able to introduce the UK type diabetic retinopathy care pathway into the system in Kerala, which is actually a very good impact because in a low and middle income country to have something which actually emulates the NHS is very difficult. But the government of Kerala was very supportive, and we did 1 year of work where we tried out the screening, we tried out to evaluate it, and we found that it is feasible. And now that pilot project, they are now enlarging to rest of the state. And interestingly, other states in India have approached us to see that it can, whether they can also do that. And what we found out is that there is quite a good impact for this screening program. But meanwhile, COVID happened. And COVID means we cannot physically do anything. And at the same time, on parallel with the COVID, we also had ICC, where our total, we suddenly become aware that it doesn't require physical communities, or we can also be a community digitally. And our COVID work, we did everything digitally. And what we did was to look at people's mental health when they are in lockdown. And we did find out interesting things in that. We found out that people's mental health really get affected. But interestingly, it is not the social mental health or social loneliness which increases, which we expect in lockdown because there is social distancing, etc. It is actually the emotional one, where we are cooped up in a house with few individuals, and that produces then, and that was a very interesting thing. And then it became very important why people should make use of connectedness through social media, etc.
So my research has recently focused on the area of online harms and cybercrime and child online protection. And I've been focusing on child safeguarding and serious offending for about 30 years. But over the last 10 to 15 years, much of my research focus has moved to the digital, and more recently to an exploration between online and offline, the kind of convergence of online and offline environments in terms of offending and victimization. I want to talk about two distinct areas of work that kind of intersect. So the first is around online harms. And we started to think about online harms in a broad sense probably about 5 years ago in the context of research we were conducting for the DCMS, looking initially at adult online harms and then focusing on child online harms. And that research has recently culminated in other work for Ofcom. And Ofcom will be the regulator, the online harms regulator, under forthcoming legislation. So the online safety bill will be legislation shortly. And a lot of our work has been conducted in the context of that legislation to underpin the legislation and to help the government think about what form the legislation should take. So that's one important area of work. And another interlinked area is really a focus on child online protection that I've really had throughout my career. And as I said, particularly over the last 15 years or so. And we initially started working in the Middle East, in the Kingdom of Bahrain in 2010, when the government approached us there and asked us if they'd help them to develop a child online protection framework. And what we did was some extensive research, national research with young people, so that we had some really good empirical evidence to underpin the framework that we helped the Bahrainis to develop. And that's been a pattern of work, because on the back of that work, other governments around the world then approach us and ask us to help them develop child online protection policies, which we've always done in situ and very much in conversation and in collaboration with in-country stakeholders. So the latest work we've done has been with the government of Rwanda in 2019, when with the Five Rights Foundation, which is led by Baroness Beban Kidron, we developed, along with the Rwandan government, a child online protection policy, which was implemented in 2019, and a 5-year implementation plan that really cuts across many different areas, including health, education, awareness raising, legislation. And the framework is currently being implemented. And we work very closely with stakeholders on the ground, with NGOs, with charities, with the University of Rwanda as well, to think about the kind of research we could develop with them to underpin some of the framework and implementation activity. And that research has recently culminated in another successful bid to the GCRF with Dr. Darren Sharpe, and who's been working with other partners in Africa, in other countries. And what we've done is we've joined forces, and our networks now work together across a series of research projects and interventions which are designed to contribute to the Youth Safeguarding Network, which we set up, the African Youth Safeguarding Network. So in the context of the Rwandan work, colleagues in Rwanda are currently developing a child online protection, a digital tool, a program for use in schools that will be an awareness raising program for young people, because their use of the internet has really expanded exponentially in Africa, particularly amongst young people. And although much of the population still don't have the same kind of access that we have to the internet, children being children will find a way to access the internet, usually through handheld devices. So this work is very important because, you know, what we plan afterwards is for a kind of sharing across the network of interventions. And we're hoping that we can then share those interventions and practices for adaptation across the region. And the other aspect of work that I wanted to tell you about was an H2020 project, a European Commission funded project that explores youth pathways into cybercrime. And this research really builds on a project that Mary and I, Professor Mary Aiken and I, undertook in 2017 for the Europol Cybercrime Centre, the EC3, when they asked us, we're both academic advisors to EC3, and they asked us to explore an area that was of concern to them. So an increasing number of young people who were being convicted for very serious offences, hacking offences against organisations and agencies, without fully understanding the consequences of their actions. And the EC3 was very keen to develop a European-wide awareness-raising campaign for young people, and also to develop some interventions around this, you know, some education awareness-raising work. And so we undertook a pilot study, a very fast pilot study, because the EC3 needed the findings fairly rapidly to inform their practice. And on the basis of that, they did develop an awareness campaign for young people. But recently, 2 years ago, our research formed the basis of an H2020 call, and we were successful in gaining funding from that call. And we're now working on a research project that includes 13 European partners working across 8 EU countries. It's led by trilateral research, and our aspect of that research focuses on the way in which young people become drawn into cybercrime. And the aim of the work, the entire project focuses on the human and technical drivers of cybercrime, but the aim is to develop interventions and toolkits that are preventative and you know, serve to raise awareness amongst young people about the consequences of becoming involved in cybercrime. And so we are 2 years into that project and are currently conducting a large-scale survey of 8,000 young people in 8 countries about their experiences of cybercrime. And so we look forward to the results from that. The research also includes a series of interviews with convicted cybercriminals in custody as well. That's the later part of the research. And we should have the findings coming through probably next year.
I think the African Youth Safety Network kind of serves as a really good example of what the ICC really does. When we talk about interdisciplinarity, when we talk about working both with policymakers, practitioners, as well as academic institutions, it exemplifies that in a beautiful way. So in each of the 4 participating countries, which are Rwanda, Sierra Leone, Zambia, and South Africa, we're working both with academic institutions who are kind of charged in collecting the empirical data, and that's predominantly kind of measuring the kind of health and well-being of their target populations, as well as developing interventions as well. And so we're working with local NGOs who are kind of delivering on the ground interventions to all our kind of target groups. And our role at UEL is very much premised around kind of co-design and co-production. So we aren't in an imperialist kind of cloak, kind of instructing partners what to do, but we kind of set up and finance the infrastructure for these partners which otherwise wouldn't have come together to have a conversation around a collective challenge, and then they're tailoring their solution or their intervention based upon their local context and their local resources. But most importantly, we come together on a periodic basis to share best practice and to support one another, both in our empirical data collection as well as in refining the intervention. And so that's one of our aspirations really, is to grow these types of professional stroke academic networks into the future, both creating immediate impact by looking at immediate problems we can solve, but also filling that kind of scholarly empirical gap also as we're going into the future. And project by project, and I guess study by study, what we're trying to do is fuse that digital and that physical world together where it's appropriate as we go forward all the time.
So from my perspective, because of much of my work is really around the digital, one of the biggest challenges for us as researchers is in staying ahead of the game in terms of changing technology, changing software, from an offender perspective, changing modus operandi, because offenders also change their modus operandi with changing technology, but also in terms of trying to stay ahead in understanding young people's use of digital media, because that shifts all the time as well. And I think as researchers, if we don't understand how young people are currently using digital media, it's then very difficult for us to be able to comment on that in an informed way. And so just to feed back to one of Darren's points, it's really then very important to make sure that the research we undertake with young people is co-led, co-informed, collaborative, because if we don't understand the way in which they're operating online, then really, it's very difficult for us to pursue our research. So I think absolutely, in terms of the digital, things change all the time. Artificial intelligence is absolutely a key debate at the moment. And the challenge for us is staying a step ahead of the game, I would say, in terms of young people's use and certainly of offending use of digital media as well.
And I would just kind of echo all the sentiments Julia just mentioned, really. And I think your question really excites me. And I think that's what motivates me every day to do the work I do, really. It's like, what are the challenges of the 21st century for young people? And when I say young people, I'm thinking of young people who are going to be the adults in the 21st century, leading industry, the educators in society. And so what I guess the challenges we face currently in relation to the NHS, if I was to give that for an example, in terms of how do we pay for all the services, what is demanded from the NHS, and that is predominantly for adults. But if we step back and look at it from an epistemological point of view or public health point of view, we know that in terms of the diabetes bill, which is ginormous, or the mental health crisis, which is again ginormous, for adults, these originate in childhood. And so my focus is, how do we crack these social problems, both the economic, social and cultural problems, in childhood? And the only way we can do that is looking at, how do young people know what they know? So what is young people's epistemology? And how do young people talk and perform and express themselves in relation to their social worlds and their life? And that's their ontology. And so only by talking with young people and researching young people's lives, often with them, but sometimes for them, do we get a better understanding as academics how young people construct their world. And that's both online and offline. And although we've been talking about that division of online and offline, if we was to ask a young person today this notion of online and offline, they probably would be a bit confused. What are we talking about? Because there isn't this neat division. As far as they're concerned, they are them, their identity, and these platforms, be it in the real world or on the online world, are expressions of them. And it's very difficult for us as adults who wasn't really schooled in IT to kind of understand that merging and how they can both have equal weight in a young person's mind and in a young person's life. What drives self-esteem, drives relationships, what can then drive addictions and deviant behavior. It's very complicated, but it's less complicated once we start talking to young people. And once we talk to young people and actually hear what they're saying, then we can tackle some of the bigger social problems. Like I mentioned, what escalate as young people become older people. And so that's what really excites me, really, and why I think it's important not just to talk to young people in a very kind of patronizing and self-serving way, but I'm looking more long-term. The young people you see in the playground are the employees of the future, as well as the employee of the future. They're the young people what will determine whether environmental sustainability, what direction we go, whether they're going to take the green route or take our current route, what we've set them already. And it's only by cracking these behavioural changes and understanding how young people see themselves, see the world and see their opportunities, I think we can tackle those more, I guess, pressing social issues.
When Julia and Darren was speaking, I suddenly realized that this challenge you mentioned about this generation alpha is also raises an intergenerational challenge. Because for a child of 7 years or younger, significant adult many times is a grandparent. And you know that while generation alpha at age of 7 may be a genius with the digital world, the poor grandparent generation may be still struggling, and that you know might create, I mean, opportunities maybe for the two generations to come together and, you know, help, or also can produce challenges. So I was really impressed with the fact that you picked up a age group, but then it goes across the life course, which Darren slightly touched upon.
Yeah, very much so. And I think it's important. And I think that's what ICC represents or covers, really, is that life course from historical research from birth all the way to healthy aging. Our research really spans that trajectory.